Extract 1. Questions 1 to 12.
You hear an optometrist talking to a patient called Dominica. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Dominica. How can I help you?
Good morning, sir.
Can you show me your registration card? Or should I search your details through your mobile number?
I think that would be better. My mobile number is 078-823-78979.
Okay, I've tracked your record. You last visited on the 27th of August, 2016.
That's correct.
Just pay the doctor's consultation fee here.
Sure, this is my card.
Please take your seat and feel comfortable. Should I help you with water, newspapers, etc.?
Thank you. Hello, doctor.
Hello, Mrs. Dominica. So how can I help you?
I just came for a regular checkup for a suspected case of glaucoma. 18 months ago, Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma and after examining my eye. He told me that my optic nerve is thicker than the usual.
That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and OCT today. And once you receive the 2 test reports, let's meet again in the afternoon.
Okay, doctor.
Yes, Mrs. Dominica?
Hello, sir. The doctor advised me for these 2 tests.
Okay, The 2 tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you?
That's fine.
Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Mrs. Dominica. I hope you had a good experience going through those 2 tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quickly, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually. They're called floaters. As we age, floaters develop to different extents. They're not harmful. Actually, floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs that the vitreous gel is pulling on the retina that can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely. Floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take a vitamin A supplement that includes selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Carrie. I'm Dr. Hamilton. Nice to see you.
Nice to see you, Dr. Hamilton.
Yeah. Your doctor had called me. I've got your notes from him.
Yeah, I've been trying to reach you for the last 2 months, actually.
Right.
I've been having a few issues, and went to my GP, and he asked me to come and see you.
Yeah, that's right.
You're a very busy man indeed.
Indeed, absolutely. Yeah, and I've been traveling for a while. That's fine. Yeah, so I've gone through your notes.
Yeah.
And I've seen that you have been in trouble for quite some time.
Yeah, I mean, clearly for the last 5 years, I've been having tummy pains a lot.
Okay.
And the last sort of a month, it's been more and more. Long before that, the last 6 months, it's been tough. But the worst in the last 1 month.
All right.
And I've been trying bits and pieces, but it hasn't helped me a lot. So
Okay. All right. Yeah. So you know that your doctor had prescribed some antacids and things like that.
yeah,
Yeah, but now we have reached a stage where we'll have to run a couple of tests.
I'm more than
Has
happy
the
for
doctor
that.
discussed that with you?
He roughly mentioned that I need some blood tests and everything, and possibly if things are worse, he said I might need an endoscopy.
That's right, absolutely. Yeah. Indeed.
So I'm ready for any sort of surprises.
Okay. Given that you have this problem, particularly when you have food, I suppose.
Yeah, well, after I eat, to be precise. So, but if I skip a meal or something, I can get it. But every time I eat something, I'm basically acidic. If I take anything acidic, any fruit juices or anything, or if I take anything spicy, I get it as well. So.
Okay. So can you let me know in detail what you feel and where you feel the pain exactly?
Well, I feel it on the lower part of my tummy.
Okay.
And exactly, it's sort of like, how do I put it together? It's a stabbing pain. I feel like I've swallowed a knife and it's like stabbing inside my tummy. That's exactly how I feel when I have food.
Okay.
Well, if I skip a meal, it's slightly different. I feel like a burning sensation inside my tummy. You feel like something's not right and something's on fire. So,
Okay.
yeah.
So does that affect your work?
Very much, yes. I had to call in sick a few times, and when I have sharp pain, I can't concentrate on my work.
All right.
Yeah.
Do you take any pain medication for that?
Well, I do take paracetamol every now and then,
All right.
and I take some ibuprofen when I have pain.
Okay.
I have tried some antacids
Right.
as
Does that
well.
help?
Well, yes and no. If it's the burning sensation, it helps. But if it's more of that stabbing pain, it doesn't help very much. I have to wait for a long time for this pain to settle.
All right. Can I know a little bit more about your diet?
Well,
What do you typically have for, say, breakfast, lunch, and dinner?
yeah, well, my schedules at work changes every week, so I don't have any set times to eat. So my breakfast could be 7 in the morning on one week and probably 9 in the morning the next week, and probably the third week I might have to skip my breakfast. It's all for, work purposes. Same as lunch, no specific times. In
What do you
terms of,
typically have?
in the morning I might probably sometimes just have a cup of coffee, that's it, and no breakfast or eat. And at lunchtime I try to grab something from outside. Mostly takeaway food.
Okay.
I've got a Chinese takeaway right next to my work. I try that. I've got a few burger places, and might try some KFC burgers every now and then. So since I don't get much time to make this food at home,
I'd like to know what your thoughts are of, what you're going through. Have you got any idea what it could be?
I haven't pinpointed on anything.
Okay.
The doctor said I could have things like gastritis or, worst case scenario, he said I might have issues with the lining of my,
It seems very likely to me.
yeah,
That's right, yes.
and
However, I can't confirm it at this point of time.
I understand that, yes.
So you'll be having a couple of tests
Yeah,
by next week.
yeah,
So first we'll go for some blood tests.
okay.
All right. Yeah, and
For
then
today, or should I come back next week?
on your way out, you can give your blood samples,
Okay,
and I'll schedule an endoscopy for you.
okay,
That should be in a few days' time.
okay,
And once I get the reports,
yeah.
I'll see you next week.
See, will you be doing the endoscopy?
I'll be there.
Yeah.
I'll be there. Yeah.
Yeah, cool.
Right. Yeah. And do you know what it is?
Well, I think it's like showing down a tube down through my throat.
That's
Yeah.
right. That's right. Yeah.
It's got a camera at the end. And
That's absolutely right. Yeah.
so you're going through the front end or the rear end?
The front end.
Yeah.
Yeah.
Yeah, I'm not a great fan of the rear end.
Yeah. That's called colonoscopy. That's
Okay,
different,
cool.
right? Yeah. And this is slightly uncomfortable, but we'll numb you.
Yeah,
Yeah. We'll spray
yeah.
something to numb you, so that reduces the discomfort.
Mm-hmm.
And it's fine. Yeah.
Okay.
Right. Any questions?
Not very much.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Okay, afternoon, guys. I'm sorry, it's been a bit of a short notice. We've been having a few incidents of IV Gelco infections. I know it's been a busy week, and we've been in trouble with a lot of things, transition through to the electronic records from paper. But we need to know that documentation is our responsibility. We need to make sure that Gelcos, once you insert them, you need to document it. We need to check on the patient. We need to work as a team. The handover should be precise, and we need to check all these factors. We need to bring down these incidents. We can't allow these to happen. Last year we had a patient died of an infection, so we need to make sure that it doesn't happen again. So that's why I called you guys up. Let's start our day by not killing a patient. How about that?
Question 26. Now read the question.
During your stay, we will work to keep you as comfortable as possible. Unfortunately, it is unrealistic to feel zero pain after surgery. Our goal is to manage your pain at levels allowing you to participate in physical therapy and other activities. We have many tools to attack pain, starting with the peripheral nerve catheter, or PNC, inserted into your operative leg by the anesthesia team. The PNC delivers numbing medication to surround the nerve that supplies feeling to your hip or knee. We supplement the PNC with other medications as needed, either in pill or IV form. One big help in controlling your pain is to keep your new joint active by moving and working with therapy. Lying in bed too long can result in more pain as the joint grows stiff. In addition to pain medication, you will receive a 10-day supply of Lovenox.
Question 27. Now read the question.
Mr. Fernandez is a 52-year-old gentleman who was admitted to the ER last night. He lives with his wife, Judy, and was found down at home. They also noted he had lower extremity swelling for 5 days and was experiencing some shortness of breath and weakness. When they arrived to the emergency room, he was found to be in atrial fibrillation with a rapid ventricular rate between the 150s and 160s. After 2 boluses of diltiazem, he was started on a drip. He has 2 peripheral IVs, an 18 gauge in his left hand and an 18 gauge in his left. Both were started in the emergency room. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on at all times and his call bell's within reach.
Mr. Fernandez, since you fell at home, you're considered a high fall risk, so we need to keep the bed alarm on at all times, okay?
Okay.
And if you need any when you get up, you need assistance, so make sure that you call when you're getting out of bed.
I will use this red button on this.
Okay, so we can count on you guys to call when you need help, right? I need to go get report on my other patients, so I'll be back in about 20 minutes. But if you need anything, make sure you call, okay?
Okay, thank you. Sounds great.
You're welcome.
Question 28. Now read the question.
I've been a nurse for about 11 years now. I started off in cardiac, which I loved, but I was working nights and I wasn't in love with that. And then after that, the school where my kids go to school opened up, and so I was a school nurse for several years. And during that time, I just felt like I had a lot of kiddos coming to me with just a variety of issues that were more behavioral issues, such as they were maybe harming themselves in some way, or maybe having some really big anger issues that they did not really know how to cope with or deal with. And I would try to help them as best as I could and get them some community support. But I really felt like I did not have all of the answers that I personally felt like I needed, or I felt like I needed a little more training. So I ended up leaving the school and worked full time.
Question 29. Now read the question.
It is true that athletes are specializing at a younger age than they did a decade or 2 decades ago. And that does create overuse problems with doing the same repetitive motions year-round, which is why we typically recommend for kids, hey, enjoy everything, be involved in everything, do a lot of different things. There will always be sports that one athlete will excel more at than another, but it's still healthy to be a multi-sport athlete and use different body parts and different mechanisms. And when you're growing and developing, that has a different impact on your body where you have open growth plates versus when you get older and those growth plates close. And if you're doing the same repetitive activity in a specific area with an open growth plate, you can have a problem there.
Question 30. Now read the question.
This is one of our mannequins, the SimMan Essential. He is capable of being a healthy patient. We can also program in variables on him that cause him to be unhealthy patient as well, because as we know, most of our patient population these days aren't your typical healthy patient. So when we bring the students into the room for the simulation, they are able to do an assessment of listening to heart and lungs on our mannequin. They can do a neurological evaluation of his eyes as well. Shortly thereafter, then, we go ahead and start the anesthetic procedure. So we start by giving him some oxygen by the mask. Obviously, he's still awake at this point in time. And then the students are expected to start the drug administration. And I am on a computer in a different room able to program the drugs that the students are giving. And then the mannequin responds to the drugs by either, going to sleep or getting sleepy. So that the students then can carry on the procedure that has been outlined for them. What's neat about these mannequins, we can mass ventilate them, we can put special airway devices in like an endotracheal tube. If they don't happen to get the endotracheal tube in the right spot, he has a blue light that'll light up in his mouth to show them the patient is not getting enough oxygen. I'm on the control and I can make the heart rate and the blood pressure change parameters as well. So it's a learning experience for them so they can identify maybe they didn't put the endotracheal tube in the right place. He also has IV access, so we can do IV practice on him. We can give the drugs through the IV. That's typically how you do it in anesthesia.
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
What are the symptoms of ADHD? Most kids could be described at some point as inattentive, impulsive, or hyperactive. Explanations for this behavior vary widely, ranging from the child being overtired to overexcited. However, when such behavior lasts for significant periods of time, and when it interferes with life at school and at home, the explanation may be due to a condition such as attention deficit hyperactivity disorder, or ADHD. Some studies suggest that about 2% of primary school-age children have ADHD, while others have suggested that almost 18% have ADHD. However, the majority of researchers put the figure at between 5% and 10%. Regarding gender, boys are at least 4 times more likely to be diagnosed with ADHD than girls. Prenatal risks. Some studies have shown a possible increase in risk among children whose mothers used cigarettes or alcohol during pregnancy. Therefore, if you are pregnant, do not smoke or use alcohol. Environmental toxins. Exposure to very high levels of lead before age 6 or so might also raise a child's risk. Some young children are exposed to lead from the dust of worn paint in many older buildings, or from drinking water that has travelled through lead pipes. Family history. Having a biological parent or sibling with ADHD seems to raise a child's chances of developing it. According to the National Institute of Mental Health, at least 1/3 of fathers who had ADHD in their youth may have a child with ADHD. For some children who have ADHD, some foods, such as sugar and food colorings, seem to trigger more out-of-control behavior. But food is not a trigger for many children with ADHD. Being at a party often triggers out-of-control behavior, which might be due to foods, but the behavior is more likely to be due to too much excitement. Sleep apnea, blocking of the airway during sleep, is linked to problem behaviors in many children. Some research has shown that about 30% of children who have ADHD have some sleep apnea. Signs of sleep apnea include snoring, often loud snoring, and stopping breathing for a brief time during sleep. Not all children who snore have sleep apnea, but if a child with ADHD also snores, this might be part of the problem. Despite at least 40 years of research worldwide, there is still no clear explanation for why ADHD happens in some children. More recent theories suggest that there is a problem with how the front part of the brain works. This causes the child's brain to deal with information and feelings in a different way from other children. It is comprised of 3 core symptom categories, which are hyperactivity, poor concentration, and impulsiveness. In order to reach an accurate diagnosis, the presence and pattern of development of symptoms in each of these categories must be considered. Hyperactivity. Children always seem to be on the go or constantly in motion. Hyperactive behaviour may be demonstrated by a difficulty in playing quietly, excessive fidgeting, continuous talking, restlessness, inability to sit still when required. Poor concentration. Children have a hard time keeping their minds on any one thing and may quickly become bored with the task. Signs that a child is inattentive include disorganization, poor academic performance, being distracted easily, forgetfulness, losing things, and poor completion of tasks. Impulsiveness. Children seem unable to curb their immediate reactions or think before they act. Impulsive behaviour may be identified through disruptive behaviours in the classroom, such as interrupting other children, poor turn-taking, blurting out answers before they are appropriate, rejection by their peers and classmates, as well as accidental injury. How ADHD affect young people. People with ADHD may not do as well at school as they are capable of because it is so hard to concentrate and stay still. In addition, schoolwork gets harder as you get older, and it may become more and more difficult to keep up with the work. Furthermore, if no one knows they have ADHD, it may mean that they do not get the special help they need. As they get older, they are expected to take more responsibility for their own learning and behaviour, and to be more organised in order to do this. This can be hard with ADHD. For young people who are not able to plan and organise themselves, for example, they don't hear the teacher's instructions, they lose assignments and homework, school gets very difficult. This can result in poor marks, being kept back in lower grades, lower self-esteem and confidence, as well as regular truancy. This may in turn mean that they drop out of school early, and leaving school early means they will reduce their chances of finding suitable employment. I would now like to describe the treatment options available for ADHD sufferers. Stimulants are the most common type of medication prescribed for attention deficit hyperactivity disorder. They have the longest track record for treating ADHD and the most research to back up their effectiveness. The stimulant class of medication includes widely used drugs such as Ritalin, Adderall, and Dexedrine. Stimulants are believed to work by increasing dopamine levels in the brain. Dopamine is a neurotransmitter associated with motivation, pleasure, attention, and movement. For many people with ADHD, stimulant medications boost concentration and focus while reducing hyperactive and impulsive behaviours. Stimulants for ADHD come in both short and long-acting dosages. Short-acting stimulants peak after several hours and must be taken 2 to 3 times a day. Long-acting or extended-release stimulants last 8 to 12 hours and are usually taken just once a day. The long-acting versions of ADHD medication are often preferred, since people with ADHD often have trouble remembering to take their pills. Taking just 1 dose a day is much easier and more convenient. As with all medications, there are side effects, and the most common side effects of stimulants for ADHD are difficulty sleeping, loss of appetite, headaches, upset stomach, irritability, depression, mood swings, racing heartbeat, dizziness. ADHD stimulant safety concerns. Beyond the potential side effects, there are a number of safety concerns associated with the stimulant medications for ADHD. Effect on the developing brain. The long-term impact of ADHD medication on the youthful developing brain is not yet known. Some researchers are concerned that the use of drugs such as Ritalin in children and teenagers might interfere with normal brain development. Heart-related problems. ADHD stimulant medications have been found to cause sudden death in children and adults with heart conditions. The Heart Association recommends that all individuals, including children, have a cardiac evaluation prior to starting a stimulant. An electrocardiogram is recommended if the person has a history of heart problems. Psychiatric problems. Stimulants for ADHD can trigger or exacerbate symptoms of hostility, aggression, anxiety, depression, and paranoia. People with a personal or family history of suicide, depression, or bipolar disorder are at particularly high risk and should be carefully monitored when taking stimulants. Potential for abuse. Stimulant abuse is a growing problem, particularly among teens and young adults. University students take them for a boost when cramming for exams or pulling all-nighters. Others abuse stimulant medications for their weight loss properties. The important diet. Current scientific evidence also suggests that diet modification can improve the behavioural symptoms of ADHD. A trial in children without ADHD challenged them with drinks containing artificial food colours and additives, or a placebo, and reported significant increases in hyperactive behaviour amongst the children who received the intervention compared to the children who received the placebo. A trial of 27 children with ADHD randomly assigned them to an elimination diet or no intervention and reported significant behavioural improvements amongst the elimination diet group. These and a number of other studies demonstrate the association between diet and behaviour. They also demonstrate that strict adherence to an elimination diet can reduce hyperactive behaviour in children.
Extract 2. Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Now you will hear an eye specialist talking about color blindness.
About 1 in 12 boys is colorblind, equivalent to 8%, and 1 in every 400 girls, equivalent to 0.4%. So in each school class, there are likely to be at least 1 or 2 people who are colorblind. Because they are colorblind from birth, most people do not know that they are colorblind. They don't know that other people see things differently. Being colorblind can cause difficulties when it is important to be able to see lots of colors, such as on a computer screen or in art classes. The words colorblindness are misleading. People who cannot see all colors are not blind. They can see things as clearly as people who are not colorblind. Colorblindness means that a person cannot see some colors, or sees them differently to other people. Very few people who are colorblind are blind to all colors. The usual colors which they see differently are greens, yellows, oranges, and reds. Colorblindness arises from the structure of the eye. In the retina, at the back of the eye, there are 2 types of light-sensitive cells called rod cells and cone cells, and these react differently to light. Rod cells are very sensitive to light, and they can react to even very faint light, such as light from a star in a hazy night sky, but they do not see different colors. Rod cells allow us to see things around us at night, but only in shades of black, grey, and white. Cone cells react to brighter light, and they help us to see the detail in objects. They also pick up colors. There are 3 types of cone cells: ones that pick up red light, others green, and others blue. By combining the messages from each set of cone cells, we get the wide range of colors that we can normally see. Someone who is colorblind lacks 1 or more of these types of cone cells. Red-green colorblindness is usually inherited. The genes that lead to red-green colorblindness are on the X chromosome. If a mother carries the gene for a red-green colorblindness, which is 1 normal and 1 altered gene, she will not have a color vision problem. About 50% of the sons of women who are carriers will be colorblind. A daughter will not normally be red-green colorblind unless her mother is a carrier and her father is colorblind. But about 50% of daughters of women who are carriers will also carry the gene. Only 5% of people who are colorblind have blue colorblindness, and this is equal in males and females because the genes for it are on a different chromosome. Colorblindness can be due to abnormal chromosome development. It is not always inherited. Boys should have their color vision tested when other people in the family are known to have color vision problems. If people on both sides of the family are known to have color vision problems, the girls should also be tested. Color vision testing can be done by optometrists using specially designed charts. Some school health services and some doctors will also be able to test color vision. After a color vision problem is found, further testing might be needed to tell just exactly what the problem is, because this can affect whether the person will be able to do certain jobs or be able to get certain types of driving licenses. There are many sites on the internet which have some color vision checking charts, but they cannot be relied on like special test charts printed on paper. It is best to get checked face to face.
That is the end of Part C. You now have 2 minutes to check your answers.